Hello, this is Dr. Stanley Lang, and welcome to this video. And I'm sharing some thoughts today related to two different patients who are sort of on opposite ends of the extreme. And they both had the same question, basically, which was, what is my risk for having a heart attack based on what I'm doing right now or based on what I'm thinking about doing? So on one end of the spectrum is a patient who is diabetic, has had a couple of cardiac events. What's his risk now for progression to another heart attack? On the other end of the spectrum is somebody that's a little bit younger, living a much healthier lifestyle, has never had a diagnosis of heart disease, but he went on the ketogenic diet, and he was one of that 30% or so of people who had a dramatic increase in his cholesterol level. And that sort of frightened him off from doing the ketogenic diet, and so he decided to stop doing ketogenic because it had raised his cholesterol level so much. Now, first of all, I tried to reassure him that that was something that was not going to be risky for him anyway, because his inflammatory markers were going to be very low, and uninflamed cholesterol is not a risk for plugging up our arteries. But nevertheless, how does he know that with a high degree of certainty? And the answer for both of these gentlemen was to get a coronary calcium scan. And this is done with a rapid CT scan machine. It takes about 4 minutes, and it gives what's called a calcium score. And what actually is being done is that the calcium level is being measured in the coronary arteries. Now, unfortunately, this isn't covered by any insurance. It costs between $200 and $400 out of pocket, but it gives a very clear picture of what the person's risk is of having a heart attack in the near future, and also a lot of benefit for tracking along in the future by comparing future scans. And so why is this important for these two people? Well, first of all, there's no question that the first gentleman has a big issue because he's already had a cardiac event. But one of the things we know about these calcium scans is if you happen to have a high score, but you stabilize it, in other words, you start lifestyle strategies and you can document that the score isn't getting worse quickly, that person's risk within a year drops way down, almost as low as if they didn't have high risk to start with. And you can only see this with the calcium scan. You can't tell it from a cholesterol profile, from inflammatory biomarkers or anything like that. Although they may be helpful, they're going to miss at least 30% of people who have really high risk and they didn't know it. On the other end of the spectrum, this gentleman who is concerned about, is my cholesterol an issue or not, will be able to tell within a moment with that score. If the score is low, his risk is low, period. It doesn't matter what his cholesterol level is. When the score is low, the risk is low. What is the thing that does cause the calcium artery score to go up high? Well, the thing that's the biggest driver for that is what is called insulin resistance. We call it metabolic syndrome. So obviously a diabetic who's been diabetic for a long time has severe insulin resistance. So we already know that the first gentleman's risk is really high, and that's why he's got coronary disease. But how can he turn that around? Well, he has to reverse his insulin resistance if he's really serious about making changes. The second gentleman, who is contemplating going back on the ketogenic diet, dramatically decreases insulin resistance, takes away the main driver for having calcification of the coronary arteries. And so, unfortunately, this is a test that isn't talked about very much in the United States. In some countries around the world, it's used a lot, not so much here. I'm not going to get into why that's the case, just to say that you can choose to get this because it's not a test that your doctor orders anyway, because your insurance company doesn't pay for it anyway. But it's something that you can discover right now what your risk is, and more importantly, use it as a yearly test to track what your risk is doing as time goes by. So I hope you found this helpful. God bless and have a great day.